Yeah, it's very common for people to find out about prolotherapy, then they wonder where they should go for prolotherapy. And there are good prolotherapists all around the globe. It isn't like, oh, Dr. Hauser, is the only doctor that does, good, thorough prolotherapy. I can say, though, you got to realize this office has been doing prolotherapy since the mid-1950s. So I've been doing it, the last 20 years, but I took over the practice of Dr. Hemwall. So, Dr. Hemwall taught me all the things that he could teach me. So technically this office has been doing prolotherapy for 60 years. And Dr. Hemwall learned prolotherapy from Dr. Hackett, who coined the term prolotherapy. So, as far as if you want to go to the most experienced place in the world, then you come to Caring Medical. So obviously I have a bias in the sense that I'm a purist. I'm going to do prolotherapy the way prolotherapy was originally intended to be done. Prolotherapy originally intended to be done was to treat the joint thoroughly. So I'm just going to use the knee model. So it means that when I examine someone's knee, more often than not, regardless of what the diagnosis is, whether it's a meniscal tear, a ligament injury, chondromalacia patella, knee arthritis, almost always they have tenderness around various points around the knee. Basically, these are areas where there's tendon attachments and ligament attachments. Also, it's very, very common when you move the knee joint that's painful compared to the non-painful side, there's more motion. So that's just called joint instability. And anybody who follows my writings on the internet knows that I believe most pain, almost all chronic pain is from joint instability. So at minimum, I would say to folks, you got to get the whole joint treated. You have to have all the ligaments treated, basically. In other words, all the ligaments that are causing the joint instability, and sometimes it's also additional tissues like the labrum and the meniscus, all these areas have to be treated. So I call that comprehensive Hemwall-Hackett prolotherapy. Like, in other words, it's the original Hackett-Hemwall or Hemwall-Hackett prolotherapy, used with dextrose as a base, and then we add certain solutions to that base, and then you have to treat all the areas. The most important thing is that the person with pain has all the painful areas treated and all the areas that need strengthening treated. So that's comprehensive. So the prolotherapy has to be comprehensive. Probably 1 out of 7 clients, it depends on the day, but 1 out of 7 clients that I see have seen another prolotherapist. Like, they know that prolotherapy is going to help them, and the overwhelming thing that they tell me is they got 1 or 2 shots. So if you get 1 or 2 shots with a solution, yeah, technically that might be prolotherapy, but it's not comprehensive prolotherapy. So if somebody comes to Caring Medical, one is you're going to get what I'll give you a diagnosis, or we'll give you a diagnosis. Then 2 is usually the diagnosis is multiple. Like, in other words, you have joint instability, you have cartilage deterioration, which is chondromalacia patella. You have joint instability because of these ligaments. And then this is what you need. You need comprehensive prolotherapy, plus, which means that we're going to use that dextrose-based solution along with potentially other solutions around the knee. And then if you need something specifically in the knee, like, in other words, if you have a cartilage issue, we might add growth hormone, we might add stem cells, we might add PRP. So it's not just PRP, like one shot, or it's just not like, oh, let's culture your stem cells and then we'll give you 1 shot and charge you $10,000. That's not ideal. That's not ideal. First of all, we should try to keep the costs down, do the therapy that's needed, and usually all that's needed is comprehensive Hackett-Hemwall prolotherapy. So in other words, 4 out of 5 clients who come to Caring Medical, that means 80% of clients that come to Caring Medical get comprehensive Hemwall-Hackett prolotherapy. That's it. They don't need PRP, they don't need stem cells, they don't need this, they don't need lipoaspirin. Just get good comprehensive Hemwall-Hackett prolotherapy and the results are unbelievable. They're unbelievable. So, in those other 20%, it means that people have special cases. They have special kinds of injuries. They have big injuries to their cartilage. They have, bone-on-bone arthritis. They don't want to get a joint replacement. Yeah, in cases like that, you still get comprehensive Hemwall-Hackett prolotherapy, but then inside the joint, we might use stem cells or other kinds of solutions. So at Caring Medical, be assured that you'll get comprehensive Hemwall-Hackett prolotherapy. We have a lot of solutions at our disposal. Obviously, you have 60 years or whatever experience, so we know like when to push the athlete, like when they're ready for certain athletics. So we normally get involved in their rehabilitation, in their exercise program. And obviously, if folks need natural medicine or they need a diet program or they need weight loss, obviously we're happy to do that. But as far as getting over the pain, it's mostly knowing what areas to treat, make it comprehensive, and obviously we try as best we can to get them better in the minimum amount of visits with the minimum amount of cost, like just like I would want to get treated if I was a client.